Adult ADHD, what actually works? Adult Attention Deficit/Hyperactivity Disorder, ADHD, is just a term to some. To others, it is a reality that is often hard to accept and cope with on a daily basis. ADHD affects every single area of a person's life, and even the simplest of tasks can become challenging. This disorder takes a toll on one's overall quality of life, social relationships, and attitude towards self, significantly impacting mood and productivity. To make matters worse, those who have not gone down this road may find it hard to fully grasp the complexity of this issue, which is exactly why people with ADHD often experience a lack of sympathy and understanding from others. And if dealing with ADHD was not hard enough, add a global pandemic to the equation. A vast majority of people have been faced with a 180-degree switch in their work routine and environment, being forced to work from home due to COVID. On top of the pressure of staying productive at home, the pandemic also brought to the surface issues such as anxiety, stress, and an overwhelming feeling of uncertainty. Even people with no attention disorder have reported difficulty staying focused due to brain fog and inattention, as well as a lack of motivation and structure. However, we are here to offer solutions, not delve into further problems. The vicious cycle of adult ADHD can be broken with simple techniques that require practice, but have been shown to work. We will not waste our time on quick fixes and shortcuts, as we are far more interested in long-term progress and habits that can truly make a difference. Mind you, the change will not happen overnight, but with these practices, you will definitely feel like you took over the wheel. What is adult ADHD? By definition, ADHD is a mental health disorder and is essentially a mix of recurring cognitive issues, including hyperactivity, impulsive behavior, and difficulty focusing. Just by stating the common symptoms, we can readily recognize the areas of an individual's life affected by this disorder: social life, school and work performance, along with self-esteem. 1. In some cases, these problems are deeply rooted in a person's childhood, but that is not a general rule. Many people develop this disorder later in life, without ever having experienced these issues before. Nevertheless, ADHD is much easier to diagnose in children than it is in adults, which makes adult ADHD that much more complex. Symptoms of adult ADHD. There are many symptoms of ADHD and their severity is quite individual. 2. One of the main consequences of this disorder is a lack of focus, being easily distracted, overlooking details, and having a hard time completing a project. On the other hand, a person with ADHD may also experience hyperfocus, which basically means getting too caught up in something to pay attention to anything else around you. ADHD also makes it really challenging to have any type of structure in your daily routine, whether it be time management or overall organizational skills. Procrastination and forgetfulness also go hand in hand with adult ADHD, which is a particularly significant setback when it comes to professional achievements. However, what may impact your education, career, and even social relationships the most is ADHD-related impulsiveness, which is often manifested through irrational, rushed decisions, lack of consideration for consequences, and even being socially inappropriate. This lack of control can also result in restlessness and anxiety, lack of motivation, and even a negative self-image. Living with ADHD and having to endure its consequences daily often leads to self-criticism, overthinking, and a serious decline in confidence. Unfortunately, adult ADHD has also been associated with other mental health issues such as substance abuse. What causes adult ADHD? Often exact causes or triggers of adult ADHD are hard to pinpoint. Regardless, we can still discuss some of the potential risks or proven causes of this disorder. Unsurprisingly, one of the leading causes of adult ADHD is actually something we have no control over: genetics. Statistically, children or siblings of people diagnosed with ADHD are more likely to develop it themselves. Therefore, it is safe to say that there is a greater chance of having ADHD if it runs in the family, even though it may not always be the determining factor. According to research, there are certain risk groups that have been labeled as sensitive when it comes to ADHD. People diagnosed with epilepsy, born prematurely, before the 37th week of pregnancy, or with low birth weight, and those who have suffered brain damage, in the womb or later in life, run a higher risk of developing adult ADHD. Finally, the most controversial factor when it comes to causes of ADHD is brain structure. While some studies have brought up the possibility of differences in the brain structure of a healthy person and a person with ADHD, others argue that there is not enough evidence backing up these claims. Aside from brain structure, some scientists have also discussed the imbalance in certain neurotransmitters and their function as one of the potential core issues in ADHD. 10 effective ways of managing adult ADHD. As we have said, there are no shortcuts, and real change cannot happen overnight, but you can certainly change your life one step at a time. It is the little things, like developing better organizational skills, or setting clear boundaries and priorities, that will allow you to truly be in charge of your life. Let's talk about the 10 ways of managing adult ADHD. Structure. While it is certainly fun and tempting not to have every step of the way planned, it is recommended to add a bit of structure to your daily life, especially when it comes to work. A bit of planning goes a long way, and it is a great technique that can help in avoiding chaos. Your planning can be daily, weekly, or monthly, but we advise easing into this habit by not planning too far ahead. This way, you will be in more control of your time since it's less likely there will be any bigger changes in your schedule, as opposed to, say, yearly plans. Time management. This step goes hand in hand with the previous one, and it could be considered one of the best ways of adding structure to your life. It is no surprise that people who suffer from ADHD often have an inaccurate concept of time, which is why it is important for them to always have a clock nearby. By paying attention to the time it takes to complete a certain task, you will be able to make a much more accurate, reliable plan. However, try not to get too caught up on strict time limits for certain tasks, as your focus will not be at the same level every day. A big factor in time management is also setting up reminders for important meetings, events, and other time-sensitive obligations, including basic tasks as well. Reminders will not only help you stay punctual and organized, but they will take a great load off your psyche and minimize stress. Work on mindfulness. Mindfulness basically means being present in the moment and in tune with your inner self. In order to achieve this state, one must cancel out both the outside noise and their own hectic thoughts in order to focus on the moment at hand. One of the best ways of achieving mindfulness and getting better at it each and every day is by practicing meditation. Meditation allows you to work on your focus, learn to ignore distractions, manage impulsivity, and understand and control your emotions more effectively. If you're a beginner, you should definitely start with shorter sessions and work your way up. While there are numerous YouTube guides on meditation for beginners, beginner-friendly apps such as Insight Timer, Smiling Mind, and My Life Meditation may be a more appealing option. Prioritize sleep. All the healthy habits we have talked about, and all the rest we will discuss later, mean nothing if your sleep schedule is messed up. Unfortunately, sleep issues and disorders including insomnia are common among people struggling with ADHD. And let's be frank, no one can expect a sleep-deprived person to be on top of their game. Lack of sleep has been known to worsen the symptoms of ADHD, making it nearly impossible for the person to function normally. One of the most effective methods for you to overcome sleep deprivation is to create a sleep-wake schedule that you will stick to even on the weekends. Also, it is essential to create a relaxing, stress-free bedtime routine. For instance, try reading a book or even meditating before bed instead of scrolling through social media, as blue light has been shown to induce restlessness. Natural supplements. ADHD medication is a topic we will not touch upon today, as it is something to be discussed with your doctor, and your doctor only. However, what we can recommend are natural supplements to help you manage the exhausting ADHD symptoms. Omega-3 fatty acids are essential to our well-being, but unfortunately, they also belong to the group of essential nutrients, meaning that our body does not produce them. Not only do they protect brain structure, but omega-3s have been found to promote overall cognitive performance, sharpening memory, focus, and concentration. Glutathione, commonly referred to as the master antioxidant, is one of the main factors in a healthy brain and optimal cognitive functions. Glutathione has been found to protect the brain against free radicals, promoting numerous brain functions, including memory, learning ability, and focus. Set your priorities straight. As someone who struggles with focus, you may find yourself jumping from one task to another, and getting to a point of exhaustion without completing either of them. In addition to sticking to your daily plan, it is important to set daily priorities so that they don't get lost in a sea of secondary commitments. This way you will make sure not only to complete your most important/urgent tasks first, but to distribute your energy and determination accordingly. Physical activity. Exercise has been scientifically proven to put us in a better mood by releasing neurotransmitters such as endorphins. Exercise has particularly been associated with a boost in serotonin levels, which is known to promote a good mood, improve sleep cycles, and appetite. Spend time outdoors. There is nothing wrong with being a homebody, but too much time inside may contribute to anxiety, overthinking, and lack of productivity. Spending time in nature, or outdoors in general, has a great impact on mood levels, especially since exposure to sunshine promotes the release of serotonin, the happy hormone, and melatonin, the sleep hormone. Improve nutrition. In addition to the natural supplements we have mentioned, it is crucial to optimize your nutrition, as certain dietary choices may trigger symptoms. For instance, excessive sugar consumption has been linked to higher anxiety levels, sleep issues, and increased hyperactivity. On the other hand, foods that have been found to promote brain function include fatty fish. If you're not a fan, there's always the omega-3 supplementation we mentioned, coffee, but not before bedtime, blueberries, turmeric, broccoli, dark chocolate, and nuts. Personal boundaries. Easier said than done, right? Often we struggle with saying no, and not only to loved ones, but to acquaintances, colleagues, and even toxic people who drain our energy. Dealing with ADHD means having a lot on your plate each and every day, so it is crucial to protect your time and well-being by setting clear boundaries. If you're having a hard time mastering this skill or managing ADHD in general, perhaps you should consider therapy or support groups, which are some of the best ways of dealing with problems and experiencing growth. Unfortunately, the pandemic we have been in for over a year now is a textbook setting for the development of ADHD. If you have found yourself nodding your head at the majority of symptoms of ADHD, you should consult with a healthcare professional, as only a professional can give a diagnosis of ADHD. However, keep in mind that a temporary state known as brain fog can be very similar to ADHD, and the two differ not only in duration, but severity, as well. Summary points. ADHD is a mental health disorder and is essentially a mix of recurring cognitive issues, including hyperactivity, impulsive behavior, and difficulty focusing. Some of the prominent symptoms of ADHD include lack of focus/hyperfocus, procrastination, forgetfulness, anxiety, and negative self-image. Typical causes of ADHD include genetics, brain structure, as well as certain conditions such as epilepsy. There are many effective strategies you can implement to successfully manage your ADHD, such as adding more structure to your routine, planning ahead, improving your nutrition, and enriching it with powerful brain health supplements such as vegan omega-3 and liposomal glutathione.
Thanks for watching. Subscribe for more wellness inspiration.